How does an oncologist explain lymphoma chemotherapy? When an oncologist explains lymphoma chemotherapy, they describe it as a treatment that uses specific drugs to kill cancer cells or stop them from growing. Chemotherapy is particularly effective against rapidly dividing cells, which include lymphoma cells. These cancerous cells, either B cells or T cells, grow uncontrollably in the lymphatic system. Since lymphoma cells can travel through the bloodstream, chemotherapy drugs can reach these cells throughout the body. This makes chemotherapy a suitable option for treating systemic disease. Typically, chemotherapy for lymphoma is given as a combination of several drugs rather than just one. This approach, known as combination chemotherapy, enhances treatment effectiveness by attacking cancer cells in various ways. It also reduces the likelihood that the cells will develop resistance to a single drug. Chemotherapy is administered in cycles, which consist of treatment periods followed by rest periods. These rest periods allow the body to recover from the effects of the drugs. For non-Hodgkin lymphoma, especially aggressive types like diffuse large B-cell lymphoma, a common chemotherapy regimen is R-CHOP. This regimen combines for chemotherapy drugs, cyclophosphamide, doxorubicin, vincristine, and prednisone, along with a targeted therapy drug called rituximab. This treatment is usually given every 3 weeks for several cycles, depending on the stage and extent of the disease. In some cases, chemotherapy may be combined with other treatments, such as radiation therapy or immunotherapy, based on individual patient factors. Oncologists also explain that chemotherapy does not only target cancer cells. It can also affect some normal rapidly dividing cells, which may lead to side effects. Common side effects include fatigue, nausea, hair loss, and an increased risk of infection. The goal of chemotherapy is to effectively destroy cancer cells while managing these side effects to maintain the patient's quality of life. Treatment plans are personalized, taking into account the specific lymphoma subtype, stage of the disease, patient health, and response to therapy. In summary, lymphoma chemotherapy is a systemic treatment that uses combinations of drugs designed to kill or halt the growth of lymphoma cells throughout the body. It is administered in cycles and often combined with targeted therapies. Each treatment plan is tailored to the individual patient's disease characteristics and overall health. Oncologists emphasize the importance of ongoing monitoring and supportive care during chemotherapy to optimize treatment outcomes and manage side effects effectively.